Thank you for joining our webinar today. The topic is addressing social determinants of health and linkages to available resources. This is the third webinar in a four-part COVID-19 webinar series, resource sharing and discussions with the frontline. My name is Patricia Horton, and I'm excited to have this conversation with you today. I'd like to begin with a quick definition of social determinants of health. These are the conditions in which people are born, grow, live, work, and age. They include things like social economic status, education, neighborhood and physical environment, as well as employment, social network, support networks, and all of these contribute to access to health care. So our learning objectives for today, first of all, I'd like to begin with, we'd like to thank you for helping us understand how the COVID-19 crisis is impacting health centers and farm workers across the country through your feedback in our previous COVID-19 webinars on outreach. Your feedback has been incredibly valuable, and Michelle will be sharing a link to that summary of the webinar. The outreach webinar was number 1 in the series, so you'll be able to capture and read the notes from that. Our main goal of these for these webinars has been to provide you with tips and resources on what you can do better to serve your communities during this pandemic, and to also provide a platform for us to share ideas and strategies with each other. For those of you who are not familiar with the National Center for Farmworker Health, we are located in Central Texas, and our mission is to improve the health of farm workers and their families by providing training, assistance, and support to health centers that serve farm workers and their families all across the country. My part during this session will be to share with you what were some of the things that we have been hearing from our health centers regarding SDOH, as well as we want to share some available resources from our website, and our guest speaker today will teach you how to use findhelp.org. At the end of the session, we're going to save a little bit of time for some questions, but feel free to type in those questions as you think of them right into the chat box throughout the webinar. Again, just our guest speaker is Bella Kirchner of Aunt Bertha. And I'd like to begin with just a brief introduction to the Increased Access to Care campaign. Over the past 5 years, along with the National Association of Community Health Centers, NCFH has led the Ag Worker Access campaign. The purpose of this campaign has been to help farm workers and their families to access care, to receive preventative and primary care through the health centers. If you're interested in participating, there are resources on our website, and Michelle will share a link in the chat box directly to the campaign. Here's a little bit of what farm workers have been saying about the COVID-19 pandemic and how it's affecting them. We're afraid, but at the same time, we don't have a choice. If we don't work, we can't pay our rent, we can't buy food. They're also thinking of, we're supposedly working so that other people can stay home so they can have food, but they call us essential workers, but we don't have any rights. So these are just some concerns that we're hearing. And additionally, we're also hearing that some of the CDC safety guidelines are not being enforced. And so ag workers feel pressured to work even if they become ill for fear of losing their jobs. Now, due to the COVID-19, the social determinants of health challenges that ag workers typically face, they continue to exist, and the need for these services has increased. For example, due to the quarantine and reduction in staff, there's minimal transportation services available at this time. Food banks that have stated that they're experiencing an increase in clients requesting resources. Agricultural workers are often already living in crowded housing, so it's making it difficult for them to practice social distancing as recommended. And also, although health centers are using telehealth to provide services, many ag workers may not have access to the technology needed to participate in telehealth. So all of these things combined create a lot of uncertainty for ag workers to access services. Other risk factors that are experienced by ag workers include things like social support. There's a lack of social support due to the fact that many of our ag workers migrate to this country to work, and so they're away from family and from friends. Another barrier is that of language. That creates a risk because of the uncertainty and the lack of knowledge around COVID-19. Additional factors to keep in mind include things like not having the option to telecommute. They need to be on the farm in order to get their work done. There's also the fact of unemployment compensation. That's not accessible to most ag workers due to the criteria to receive unemployment services. And the majority of ag workers don't have sick pay benefits like most of us. So there's also the lack of childcare due to the schools being closed. Some of the challenges that we've seen and heard from our community health centers are things that there's a need to quickly learn how to use new technology, right, to provide telemedicine services and to treat options. Ag workers may not know how to use the telehealth services or have access to technology. And then there's also the occupational hazards for staff, including limited personal protective equipment and supplies. So healthcare workers are unable to provide outreach in the communities that they serve. So that has decreased quite a bit. So we have one poll question that we're going to launch. And then we'll have just a couple of questions right after that.
Okay, I have launched the poll question. The question is, what is the top social determinant of health need or service that's being requested right now? Is it A, financial assistance, B, housing, C, food, or D, family support? I'll give everyone a few more seconds to respond, and then I will close the poll. Okay, the poll has been closed. The results should be on your screen. And it looks like 56% of you answered A, financial assistance, 31% answered C, food, 10% B, housing, and 3% family support.
Thank you, Sylvia. That is really helpful information. So we can see where our ag workers are hurting right now, and it'll help us to be able to better serve them, to look for these resources and how to do that. So we want to pull together and share our knowledge, what we've been experiencing, and how we have been able to respond to these needs. So think about what we'd really like to hear from is you. How has your health center responded to some of these requests around financial assistance, around housing, food, and family support? What are some of those creative ways that your health center staff is responding to these needs? So please use the little hand feature so that we can unmute you, and we'll do some sharing. Also, something else to think about is, is there an organization that you've been referring, or maybe, what referrals to what, to certain organizations have been helpful to fulfill some of these needs, such as especially financial support or food resources? What are some of the things that you're doing in your communities?
Okay, Patricia, I see that Marcella has her hand raised. Marcella, I will go ahead and unmute you at this time.
Thank you. Good morning, everyone. About food, we are receiving food donations, and we do food distribution in the migrant camps once a week. We are calling members, allow them to ask questions about what is happening right now for them, what kind of need they have, and if they have questions regarding COVID-19 or not related to COVID-19. A Promotores program is reaching in different language, and we are trying to connect with different services, taking in account that the need they express to have.
Thank you, Marcella.
You're welcome.
Those are great strategies, coming together and working with everybody. If any other hands raised?
I'm looking through the list. I see Hannah has her hand raised. Hannah, I will go ahead and unmute you. And it looks like you're self-muted on your end, so if you can unmute yourself, you're unmuted on my end. There you go.
Thank you. Hi, everyone. This is Hannah with the Bean Mobile Health Program. We set up sort of a triage system for access to essential needs or addressing social determinants of health through our health center. We're specifically starting by looking at what resources exist already in the community for our patients and their families, thinking specifically about local food banks and what other resources there are for access to food, and similar how folks can access. There's a rent assistance program for folks in the entire state of Maine, and so how to help folks who don't speak English or have access to technology needed to make those applications. And then there's also a partner organization of ours doing a mutual aid fund specifically for farm workers and immigrants, and then open to others if there is money and space. And so we're working on referring folks to that as well. But we've also set up a system internally to look at offering gift cards for folks where none of these other services are fitting the needs that they're asking for. And so we're trying to sort of use a little bit of our financial base as the sort of fallback last resource if there isn't something within the local community already.
Thank you, Hannah. Wow, those are some great ideas. Definitely.
And, oh, I'm sorry. Go ahead, Patricia.
No, go ahead. I was going to ask you.
Elena has her hand raised. Elena, I will go ahead and unmute you now.
Good morning. Here at Adelante Health Center in Arizona, we are currently partnering with all our food banks so that we can disseminate this information to the parent liaisons for the schools. So like right now, about 2 o'clock, we're going to have a Zoom meeting with the parent liaison, migrant parent liaison for the schools, and we're going to talk about the different information that they can give out to the parents, such as the food banks. We're also partnering with the City of Phoenix and the CAP offices for utility assistance. Whoever still has funding, we're giving that information out to these parent liaisons because they have direct contact with the migrant families. And I'm also coordinating all the same information to flow out to the farms because a lot of the administrative offices in the farms are calling us for questions that some of their workers are having some of these issues. So that's the same information. We're trying to share it broadly so that everybody has the same format and is giving out the same information.
Great, thank you, Elena. Those are great ideas. I see in the chat box that Oak Orchard Health is working together with FoodLink, and they've been able to pick up food boxes to distribute to migrant workers that are in the area. See if there's, so yeah. So a lot of great opportunities to reaching out to different communities and building those relationships and working together, which are critical in the work that we do. Let's see. Next, do you have another?
I don't. I was gonna say that I don't see any other hands raised at this time.
Okay, we'll move right along. So this next question is, we really, we're here to support you. We do training and different technical assistance and support you. So what we'd like to hear is, how can we support your efforts? How, as you, as a health worker, as an organization, think about some of the tools that you might need. Could be around training or resources, or maybe it's just, helping you manage stress, anxiety. Michelle will be sharing a link that's, I know during these times, even when we're not in the middle of a pandemic, it's important for providers, healthcare workers, to take care of themselves. And so Michelle is going to include a link on some strategies for you to access. But we'd like to hear, what is it that you need, and how can we better support you with, in your work? So again, if you'll please click on the little hand icon, and then we'll unmute you and we'll share a little bit.
You can also submit any comments in the chat feature if you'd like to comment on that using the chat feature.
Thank you, Sylvia. There's been a lot of great information and resources that is available, and sometimes just navigating and finding what you need can be a challenge of itself, right? So maybe it's, if you're looking for a resource and you're pressed for time and can't find it, reach out to one of us here at NCFH, and we more than glad can find it for you and send it to you directly. That way you can have it quickly. So, and later we're going to point out a few of the resources that we've come across, a few of the resources that we have on our website as well. So, from your experience, is there anything that you feel would be of benefit to you that you don't have time to dig up or to find, or that you feel is lacking. We'd like to get some ideas. And you can, like Sylvia mentioned, you can type that into the chat box as well. We can come back to it later. Okay. Well, one thing that I've been hearing also is building those relationships with the growers and the labor contractors, things like that. And I will point it out later, but we do have a link to our archived webinar that would be great if that's something that you're interested in learning more about. Would be a good source to look at and take some notes to help you build those relationships. We're going to go ahead and move forward. And like I said, if you think of anything, please type that into the chat feature and we will come back to it later. So now
Okay.
I'd like to, Sylvia, were you going to say something?
No, proceed. I was going to
Okay.
say if you were ready, then I can change it over to Bella.
Yes. I'm going to turn it over to our guest speaker, Bella, from Aunt Bertha, to share a resource with you today.
Okay.
Hi everybody. Let me make sure. Are you able to? Okay.
Okay,
Great.
Bella, I've changed it over to you now.
Okay, I've got it. Can you see my screen?
Yes.
Fantastic. Yeah, thank you all so much for having me on today. You know, I think as Patricia mentioned, my background a little bit. I've worked, or I think it was Sylvia who introduced me. I've worked in community health for a long time at a large FQHC and a smaller community health organization here in Texas. And so the work that you all are doing is very close to my heart. And I know how important it is right now and how scary it is too. So, you know, I think I just wanted to say that I really appreciate all that you guys are doing for your communities out there. And so I've been kind of in talk, the way this kind of came about is that we'd been connected to Patricia and Sylvia in the organization and had talked to them a little bit about this resource that we have. And so as they were coming up with these webinars and thinking more about social determinants of health, they reached out and asked if we would share this platform with you. I'm guessing that many of you potentially may have already heard about Aunt Bertha, but this is just to give you kind of an update. If you haven't heard about us, to give you a little bit more information about who we are and how we can be helpful. And that's really what we're trying to do in this time of need, is to try to get people connected to help as much as possible. That's our mission. And so we, Aunt Bertha has been around for about 10 years, and we are an online platform that essentially we are a search and referral platform for free and reduced cost social services. And we have, we essentially gather data, gather information about programs that serve the communities that you all are serving with those free and reduced cost programs. And they range from, you know, food related resources, goods like diapers and formula, utility bill assistance, legal aid, healthcare, all kinds of things. And we try to give people one place to go to find that information about those resources. And we have resources listed in every zip code in the US. And so, you know, for those of you who've heard of us, we have auntbertha.com, which is a free site that you can go to. When the COVID crisis hit, though, we actually stood up very quickly this findhelp.org site. Again, this is all free for you to use. You can go to the web right now. It's a site that you can give, that you can share with your patients. You can share with anyone that you work with. And it is a place where you can put in your zip code and then find those free and reduced cost programs. And this version of it, findhelp.org, it's got all the same programs that auntbertha.com has. However, the search is updated a little bit in that it brings programs that are specifically related to the COVID pandemic kind of up to the top of the search. So I'll show you what that looks like. So the plan is for me to just kind of walk through how you use the resource, and then I'll pause for a minute to see if there are any questions. I'll also, it's really interesting to hear kind of the feedback from you all on what you're seeing out there as what's most in need. Since we do have kind of a national footprint, I also wanted to just share some data with you all that you might find interesting from some states that I heard that we have kind of representatives from around. So yeah, feel free as you do have questions to put those questions into chat, and I think Sylvia is going to help me keep track of those. And so I'll pause in just a little bit to take some of those questions. So when you go to findhelp.org, the first thing that you're going to do is put in a zip code, and I heard somebody mention the Phoenix area, so I went ahead and put that zip code in here and then click the search button. My internet's been a little slow since I'm working from home, so I already put that search in and am now looking at essentially a list of all the programs that serve people that live in this zip code. And so what I can do now is I can go through and either use these buttons up here at the top to help guide my search. And again, as I mentioned, you can see the various types of services that we list in here. So food, we're seeing a big spike in emergency food and food delivery program connections going up. Goods, as I mentioned, so people who may be out of diapers and formula, for example. You all mentioned transportation is an issue. And so we kind of bucket all of these program listings into these various areas. Financial assistance was another one. So this is help paying for various things. And when I go to click on one of these, so I'll go ahead and click on food pantry. This is now going to bring up a list of all the food pantries that serve that zip code that I put in. And so this, it provides you with a little map so you can see where in relation to you are, those programs are. And as I mentioned, the programs here, you can see the COVID-19 related programs are specifically bubbling up to the top. And so that's because we've been listing, I think we've now listed over 2,500 programs that are specific to the COVID-19 crisis. And so those bubble those up to the top, again, kind of given the situation that they're in. So now I'm looking at food pantries that serve this area in Phoenix. And what I can do is kind of get a little bit of information here about what they provide. And then I can click on here for more information. And what's really helpful about this is it provides me with eligibility. So if there are any eligibility criteria, if they have to be a Medicaid patient, for example, or be in a certain income level bracket, that will show up. I can also see their availability. So if there's a wait list or they're not currently available, I can see that. And then I can see the description of what they provide, the languages that they offer, if they're either free or reduced cost. And then I can connect to any of their social media accounts and then see when they're open. The other thing that's really helpful is to, you can see what the next steps are. So in this case, it's telling me to go to the program's website. In other cases, it may have me go to a location or call a phone number. And again, I can kind of see what their hours are, if in this case, this is actually a center that I would show up for. So this can be really helpful if you're trying to, again, provide someone with the ability to kind of see what resources they have or what's available for them. You can share this information with them as well. So if you're talking with a patient and you want to provide this information, you can send them either an email or a text message, and that will go straight to them. And again, they can click on a link to get to this program. The other thing I wanted to point out as well is someone also mentioned that there are various languages. You all are working with people that have various languages. So we do offer the ability to translate these pages as needed. So if you have a patient who speaks Spanish, for example, you can come down here and change the language to Spanish, and it will change the page here. So that can also be helpful as well if needed. The other thing I was going to point out too is that we also have the ability to filter on these programs. And so with personal filters, you can see that there are various types of groups. So if it's a certain age group, low income, for example. The other thing that's helpful too, under program filters, again with that language, if you want to see programs that are specifically offered in a certain language, you can do that as well. And when you go to do that, it will then filter my search based on what I just selected as well. And so this is out there, findhelp.org. It's totally free to use. You all are welcome to, again, we're just trying to get the word out and share it as much as possible. I'll go ahead and pause there before I continue on and just see if there are any questions. so far.
Okay, we do have one, Bella, that I received, and Matthew is asking about the resources in their area. His organization is located in the Texas Panhandle, Region 16 ESC. They serve migrant and farm worker students, and he's asking, is there a way your program could expand to help them serve migrant and farm worker families in that area? They're outside of Amarillo, and the area is so rural that finding accessible health services is difficult for their families.
Yeah, that's a really good question. That's something that we're seeing kind of all over, is that out in rural places, right, in some cases, there just aren't a lot of resources. So, you know, I think if we can be helpful in terms of reporting for you all, if that's helpful when you're talking to funders or others, we would be, you know, happy to provide you all with information. The other thing too, you know, essentially what we do is we list, right, all the programs that are currently out there. I did want to mention though, if you are searching on our platform, so let's say you're searching in that part of the Panhandle where we don't necessarily, you know, we don't have a lot of customers or traction out there. If you, and this is just true for anyone on the phone, if you all are searching and you know about programs in your area and you don't see them, please, if you can, we would love for you all to suggest those, and we can get those listed fairly quickly. But there's a suggest program link down here at the bottom. I'll open up that tab, and that's where if you yourself have a program that you don't see here, or if you know about programs that you're not finding, you can quickly suggest a program. And what our team does is they take this information and then they do all the research and make sure that it gets updated. And then they will contact you to let you know once that gets updated. But that's really valuable for all the other folks in your community that are looking for those resources. We do our best to try to list everything we know about, but especially in this climate as things are really rapidly changing, please feel free to suggest any additions if you don't find them. And then the other thing I'll note as well, if you're looking at these program listings and you find, for example, let's say you're looking here and you find that our hours are out of date, so you call, you know, you were just heard that they're now open on Saturday or Sunday. You can also suggest program changes from here as well. So you can just send us a message that says, oh, you know, the hours are out of date and now they're open on Sundays. And again, we'll get that and we'll update it as soon as we can. So I hope that answered your question. Again, we list what we hear and know about, but if there's more information out there, let us know. But and again, if you have any, if we can help with reporting, you know, to help you talk to funders or other people in your area that may want to invest in resources, we're happy to talk about that as well. Any other questions?
Okay, we have a comment here that says it will be nice. They could put something that says what immigration status is eligible, if it's only U.S. citizens or other.
Yes, and when we do know about that, we will put that information in here. So under this eligibility, if we do find out that there is, that it's for citizens only, we will we'll put that in. And again, that's another change, that if you find out that this program, it's anyone who has U.S. citizenship can access this program, and we haven't put that in, feel free to send that in as well. But we try to, that's one of the things that we do try to keep updated as much as possible. Other questions?
I don't see any others at this time.
Okay, I'll talk about a couple of other things that might be helpful. So as I mentioned, you have the ability to share this platform. You can also take your own notes on here. So if you are going to actually use the platform to refer people on, you can create a login and you can keep track of the people that you've helped. So you can see that I'm logged in here as well. And you can also take notes for yourself about that. So if you wanted to say, oh yeah, you know, this is a great program, keep this one in mind, you can. That only shows up for you in here. But the other thing I wanted to also show you was I'm currently in our demo, so that's real findhelp.org, Real Aunt Bertha with all real programs, so I can't actually send a referral, it will send a real one. So I've gone over to our demo site. And so what I'm going to do is look for a program and just show you how it looks if you're logged in and you actually want to keep track of the people that you're helping. So in some cases, if you have promotoras or community health workers or care managers, case managers, and they want to try to keep track of the people that they've actually referred on to, we do offer the ability to kind of see that closed loop. So here are, here's the Bertha claims here. And so I can go ahead and refer my patient on. I can either, again, refer myself or someone in my family, or I'm actually going to refer one of the patients that I work with. So Katie here, because I've helped her before, it remembers that information. And then I'll go ahead and say the best way to reach her is through email, and we'll confirm consent that I'm getting this information. So what this is now going to do is this will actually send a referral over to this program. But for me, as the person helping Katie, it'll also keep a record for me to keep track of too. So I've just referred her over, and now I can go to the people I'm helping here and keep track of all the people that I've sent referrals onto. So it takes a minute because we're in our demo environment. Let me see if I can find her. Hold on. Sometimes it gets a little, oh, there we go. So here's Katie. Oh, I wonder if it's confused because I'm, maybe confused because I'm in both the real one and the pretend one. Hold on just a minute, I'll go in and show you here. I'll just show you what this looks like. But what you would be able to do is essentially just keep track of the referrals that you've sent for this or that you've sent on for this person. I haven't actually referred Tanya, but this is where I could see all the referrals that I've made for her and keep track of those. So that all comes with this findhelp.org platform when you create a login. So before I switch over to talk, and I will say, I think they're sending out a 2-pager that has more information just about findhelp.org and how to use it, and then some additional information about additional functionality that we have if your organization decides to become a customer of ours. We do have Yakima Valley is one of the farm worker health centers that is currently kind of signed on. You have the ability to kind of take our platform and brand it for your organization if you'd like. So there's more information about that if you're curious and just want to know about more features and things that you come on. But really what we're trying to do as much as possible is spread the word about findhelp.org, which is free for everybody to use because we want people to connect to help as much as possible. So before I move on to talking a little bit about the data, I'll go ahead and pause there and just see if there are any additional questions about the platform itself.
Okay, Bella, there is another question asking, does this database link to EHRs?
Yes, so we do have integrations with electronic health records. So when you essentially kind of come on and not just use a free site, but kind of partner with us and become a customer of ours, we have the ability to integrate with a variety of electronic health records. And again, that information is in the in that little 2-pager that I have. And so you're welcome if there's an email on that handout, hello@auntbertha.com, where you can email us to get more information. There's also, you can also go to the website as well to find out more information about all that. But we do have some integrations with some electronic health records out there.
Okay, thank you, Bella.
Is that it? Anything else?
I don't see any others. Any other questions before we move on? Okay, no other questions at this time, Bella.
All right, so what I'll do now then is just show you all briefly, because I know we don't have a ton of time left, but just show you all a little bit about some of the data trends that we're seeing. And I was actually going to do this live in the system, but then again, my internet is pretty slow. So just in case, I went ahead and made a PowerPoint presentation. But, you know, I think you all know this very well, right? The system's too hard to navigate. You have patients, you're trying to connect them with programs, especially in this day and age as these programs are kind of overwhelmed. So what we're trying to do is make it much easier. I mentioned that we do have that kind of national footprint. So this shows you where we have searches happening all across the country. So we've had more than 3 million people use our platform to search for help. And our mission is really to connect all people in need and the programs that serve them with dignity and ease, and especially in times like these when there's the health crisis that will inevitably lead to an economic crisis. We want to be there for people as much as possible and make sure that we can get people connected to those services. So what I'm showing you now is kind of the COVID-19 impact on our search volume. So just like you all were saying, these are kind of the biggest areas that we see you know, people needing help in, so food, housing, and transportation. And you can see underneath each of these the breakdown of food pantry, emergency food, food delivery, and you can see the growth that has happened since COVID-19. So that lighter blue is our regular kind of search volume, and then you can see how much it's increased, relatively speaking, since COVID has happened. And so you can see, of course, that food delivery has almost doubled. And again, that's because people, right, are trapped at home. Emergency food has almost doubled as well, because again, people are in crisis. We've seen an uptick in helping to pay for things. So normally this is actually, what's interesting here is looking at help find housing versus help pay for housing. Normally under normal circumstances, you can see that help find housing tends to outweigh the paying for, but again, now that people have lost their jobs, they're not able to pay their mortgages or their rent, they're really looking for assistance in housing. And again, transportation, people are trying to get to healthcare as the, you know, as COVID becomes more predominant, and they need transportation. So you can see we've seen a growth there, again, helping for gas. So those are just kind of the overall like relative trends that shows you where we're seeing a growth across the country. And then what I'll do is I'll switch into kind of just showing you, I know we have people from all across the country. So I know we have some representation from folks in California. So you can see our program connection. So this is when people actually connected to a program, they clicked on the site, they clicked on, you know, to connect to the phone number or interacted with the program in some way. So you can see the significant growth that we've had since COVID-19 started. And this is a trend that you'll see throughout all of these states. In California, you can see that food is by far the biggest search category there. So more than 50% of the searches that we're seeing on our platform are related to food. And that is evident in the most common search terms that people are selecting. So food pantry, emergency food, and food delivery. Meals, help pay for food. And then you can see week over week, you know, with COVID happening, kind of the change in the volume of those searches. So you can see that food took up a much bigger portion as we went on in the weeks. So that's California. I know we have some folks from Tennessee. So again, you see that same trend, the big uptick in people reaching out to programs using the platform after COVID started. In Tennessee, what's interesting is that food is actually not as big of a search. Instead, housing is the largest searched for trend. And so again, you can see help pay for housing and help paying for utilities. You all mentioned financial assistance, help pay for food, help pay for internet. Those are all the top search terms that we're seeing in Tennessee. Again, here is their week by week trends. So again, how housing is a bigger focus, again, from our lens, what we're seeing in Tennessee. And then finally in Wisconsin, same, again, you get that rapid growth and connections over time after COVID. And housing and food are about equal. Health actually takes up a bigger chunk of the searches in Wisconsin than it does in some of the other areas. So that's just kind of a high level overview, but I think it confirms what you all are seeing out there, that, you know, food, financial assistance, paying for housing, transportation, those types of things are at the top of people's minds these days. And so if we can, like I said, if this platform is helpful at all in terms of helping connect people to resources, we hope that you will use it and share it as much as possible. So I'll pause there and again, see if there are any last questions.
I haven't received any additional ones in the chat.
All right, so yeah, I just want to say thank you all so much for letting me kind of share our tool with you. If you ever have any questions or want to know more, you can email hello@auntbertha.com and we'll reach out to you very quickly. But we're, again, very thankful for the work that you all are doing to help keep all of your patients safe and all the work that they're doing for us across the country with the food supply. So I'll hand it back over to you all.
Wonderful. Thank you, Bella.
Thank you.
Patricia, you are now unmuted, and I will switch it back over to you.
Thank you, Sylvia. Let me transfer back. And thank you, Bella. That's a wonderful resource to have. So I'm new. I had not heard about it, so I really like what I saw. Thank you. So I just want to quickly highlight a few resources that are available to you. This is our COVID-19 webpage available from our main ncfh.org site. And this link, if you click on the resources, it brings you to a page on different resources. And what I want to point out about this is that all of the resources on this page are specific to ag workers. If you go to the resources for health centers and providers, I just want to, we're seeing more health centers moving to telemedicine. So there's resources like guidelines on how to, transition to that. The other day I was on a call and drive-through procedures for COVID testing came up. So you don't have to, start from scratch. There's some resources, guidelines that you can use to start with and then customize for your center. And then in Spanish, the Harvard Health Publishing COVID-19 fact sheets, that's in over 35 languages. So if you're looking for something in a language that you typically don't have, this is a page that I highly recommend that you can come to. So close that. And then Michelle was going, another thing that we've heard from health centers is they're doing more public service announcements. And so there was a question about, are there any audio clips or video clips that are specific to this pandemic that we can use? And there are. And so Michelle is going to share a link. It's from the CDC Public Service Announcements page, and that has audio clips, video clips in different languages that you could use. Okay, close that. This other resource I want to share with you is the Call for Health, and it is available for farm workers and for health centers to call in for information. It's nationwide, it's toll-free, it's bilingual, and it's very easy to use. We also have partnered with the Justice for Migrant Women, and this is part of a campaign that provides masks for farm workers and healthcare centers. So it's a great resource. There's limited quantities available. If you're interested, I would get your order in. This slide has the information that you need to be able to get your mask sent to you. Are some resources available through our website. you're not familiar with them, there's templates that you can take, the digital stories, a lot of good information there. Because this is we're talking about social determinants of health, I wanted to point out this webinar series that the Farmworker Health Network put together, and it's available through the Health Outreach Partners website. But there's a webinar with specific speakers, each one devoted to transportation, another for housing, and then food security. And those are recorded and available on that website. And then there's many more websites with the different training and technical assistance partners, cooperative agreements. So I highly recommend to take a look at what they've got available. We have one webinar left in this series, and that is going to be next week. It's effective diabetes prevention and management during emergency situations. Now, if there's any questions, in closing, any additional questions that we can answer for you at this time, we have a few minutes for those.
Okay, Patricia, I do see a question from Marcella. It says, what possibility is there to offer the COVID-19 test for agricultural workers in order to contain the contagion?
That's a very good question. Any of you out there that would like to answer that? Or share what you're doing in your areas?
Okay, Bethany has entered about 87% of migrant health centers offer COVID testing.
Great, thank you. There's also, I'll need to, if you send me your email and phone number, there is right across the resource of a couple of, I think in the West Coast area, where health centers were, got together with an organization to provide testing for farm workers. And so I'd be more happy to forward that information to you. Just type in your information so I can reach out to you after this webinar.
Okay, thank you, Patricia. And we have another question from Joanna, who has asked, do you have any resources in Spanish in case a patient is positive for COVID-19 and has to be isolated in a migrant camp setting?
Yes, if you go to the NCFH website and click on, it's on the main page, the COVID-19 resources, and I think it's maybe the 4th or 5th link, which is resources in Spanish for farm workers. There's a lot of resources there in Spanish. And if you text me your name, your email and phone, I will pull that link and email it directly to you so that you have it at your fingertips.
Okay, and then Sun Young has asked to have a link to the Harvard COVID-19 fact sheet, which Michelle has entered that link in the chat box.
Great. Maybe if you don't have time to, maybe we can consolidate some of those resources and links and send them out later with the PowerPoint, Sylvia, so that everybody has those at their fingertips.
Yes, I can. If
Okay.
that is helpful, we can sure do that. And then, let's see, Kristen has asked, in reference to the mask, would you recommend the organization we order them or provide that information to migrant workers, migrant camp operators?
Say that again.
The organization is asking for a recommendation of the organization to order the mask or provide that information.
Oh.
Which you can call the Call for Help program line, and we can take that information for you.
And then the
One way.
link,
Mhm.
yeah, and the link and the phone number is in the PowerPoint, which will be sent to everybody too, right?
Yes. Uh-huh.
Okay, perfect. And yes, if there's anything in, specifically that you'd like for me to send directly to you, just type that in the chat box and I'd be more than happy to get that out to you. Okay, let's, again, in closing, I want to thank Bella for your information on findinfo.org. I get that, findhelp.org, useful tool. And this concludes our session today. Thank you all for joining us. Have a great afternoon.